Started. Let's take just a second to get to know each other. If you just would just unmute your microphones one at a time. I'll just ask you. I'll go on the order in my screen. Just tell me who you are and where you're from. And Olga, I'll start with you. If you go ahead and unmute. There.
Yes, I'm Olga Pittman. I'm with DBHDD Region 3 Field Office. I'm the Children, Young Adult, and Families Program Specialist.
Great. Thanks, Olga. And Gabrielle, tell everybody who you are.
Hi, I'm Gabrielle, or Gabby. I am actually working with Voices for Prevention right now, just helping out here and there until this big event on March 9, and I'm really excited to be a part of things.
And I hope I pronounced your name right. Is it Zuri?
Yes, you did well on the first try. My name is Zuri Jackson, and I'm with Caring Treatment Centers, and I'm located in Atlanta, Georgia.
Great. Thank you. And Yolanda?
Hi, I'm Yolanda Moon. I am also with Caring Treatment Centers, and I'm a student assistant specialist.
Perfect.
And I'm from Atlanta.
Great. And Daryl? You're muted, Daryl.
Oh, I'm just talking, and good afternoon again. I am Daryl Nettles, and I work with the Georgia Cancer Center, the Georgia Cancer Prevention, Control, and Population Health Division of it, and we're in Augusta, Georgia.
Wonderful. And Michelle?
Hi, my name is Michelle Hill. I'm with Drug Free Fed. I'm the Youth Action Team Liaison.
Great. You know Michael then, right?
Yes, ma'am, I do.
Okay. And Carolyn?
I'm going to do public pay.
I'm Carolyn Fields. I'm from Southeast Georgia.
Oh, lost you a minute, Carolyn. All right. All right. And Michael?
There we go. Publix wanted my feedback. Then they wanted to know that I want to shop the store.
Okay.
No, I just want to pay.
All right. Michael, are you there? No. I lost.
Thank you.
And I guess we got Tasha.
Thank you for making this so easy. Thank you.
Michelle, could you mute? Tasha, would you like to introduce yourself?
Hi, I'm not sure if you can hear me.
I can.
Okay, good. My name is Tasha Thomas. I'm with Caring Treatment Centers, actually in Orlando, Florida is where I am located.
Wonderful. And Cassandra?
Cassandra said on her chat that she's trying to get her audio working, so.
Okay, yeah, I saw that. All right, well, and without further ado, I'm going to share my screen with you and just give you a brief introduction to my general soapbox. And I know we all work in substance use prevention, but tell me if you can see something that says teen drug use is not inevitable. Is everybody seeing that?
Yes, it's on the screen.
So one of the biggest, when we talk about all our prevention activities, whatever substance we're working in, one of the biggest issues and barriers we face is the social norm that exists in so many communities that teen drug use is inevitable. It's an unavoidable rite of passage, and all kids are going to be experiment. And as long as it's not heroin, I can kind of breathe a sigh of relief, and nothing can be further from the truth. So I start every presentation I do, no matter what subject I'm working in, with this: teen drug use is not available. No use of alcohol, nicotine, and marijuana or other drugs is a realistic choice. And according to 2018 data, and this is a testament to all the hard work we've been doing, 58% of high school students have not used any alcohol, marijuana, nicotine, or other drugs in the past month, and 31% have not used any substances in their lifetime. And that is a huge improvement that has been steady from the 1970s to now. So that's an incredibly, to me, When we get frustrated sometimes, when we see fentanyl overdose rates going up and we see vaping rates going up and we get discouraged, look at the good work we're doing. Now, as far as the nicotine is concerned, this slide is from the 2019 National Youth Tobacco Survey. It shows that between 2011 and 2019, see great public health success. The rate of cigarette smoking among youth is going steadily down. But look at e-cigarettes. So e-cigarettes have become the primary tobacco product used by youth. And yes, e-cigarettes are a tobacco product. Any product that has nicotine in it, and nicotine is only derived from tobacco. The 2020 national study had some good news. It had good news since some of the vaping rates did slide down. The caution there is we're not sure if that has to do with access related to more kids being home during the pandemic and they're home with their parents and their parents are working from home. So we don't know if that's a real decrease in use or if that is an artifact of the pandemic and that once we get out and back to normal, if that's going to change. But we did have some decreases in both high school and middle school. However, the use of disposable e-cigarettes has surged. When the juul pods, when the flavors were limited, the FDA only addressed the pod products. They did not address the other e-cigarette products or the e-cig juices, the vape juices you can buy in a store for all the tank and mod devices. It only affected the pods. So the disposable e-cig use has surged and they are very, very high nicotine devices. And 8 out of 10, they're still available in every flavor under the sun, and 8 out of 10 kids use e-cigarettes. So that is our issue. And why are we concerned about that? Nicotine is a very dangerous drug when you talk about youth brain development. Kids' brains go through a rapid growth phase starting at age 10. The prefrontal cortex, your frontal part of your brain, which is your thinking, your problem solving, your risk evaluation, higher executive functions, isn't fully formed till age 25. And we know, and this is researched through more than a decade, that nicotine reduces the ability to attend and learn and affects learning memory. It affects impulse control, and it is related to an increased incidence of mood disorders, including depression and anxiety. And we're battling a youth suicide surge at the same time that we're looking at a tobacco use surge. We need some more research to see if those are linked in some way. There is a huge risk of other substance use. All teen drug use is related. Use of one substance increases the risk of other substance, and eventual diagnosis with a substance use disorder, and vaping and tobacco use of any kinds of risk factor for EVALI. So I will stop with that. And I'm going to turn it over you for questions, concerns, and also any anxieties you have and what to do about setting up information with your legislators. So the floor is yours. You will each be getting a sheet that will look something like this, that this is of leave behind for legislators. Are you seeing this? It says tobacco vaping sheet for legislators. It will have a lot of information. You will get this sheet in plenty of time. It's still in draft form and has to be approved by DBHDD, but it's got some data and information to leave behind about nicotine use in Georgia and tobacco use in Georgia. You also will be getting let me flip this out to you, discussion guide. Let me see if I can share this with you. But you also be getting, and I'm having a little trouble bringing that up right now on my share screen, but I'm not going to mess with that. And did you guys get the tips for virtually meeting with legislators? I've got that up on the screen now. So what can I answer for you, and how can I help you get better prepared? Any anxieties about setting up virtual meetings? And do you know how to do that? Let me ask with that. Do you all know who your representatives and senators are? Please feel free to unmute and
Hello, this is Michelle. So I think for me, where my apprehension comes is I'm grateful to have like the tips and whatnot, but it's like I kind of don't know what I don't know. So I've never done it before, and I haven't been involved in prevention work for very long. So that's where a little bit of the apprehension comes in, just like not feeling confident that I know what I'm doing.
and what's your in your prevention work? Tell me a little bit more about yourself. Where do you work?
The work that I do with SAPAD Factor is not my primary occupation. So I actually work in academia. That's my full-time job.
Okay.
But I do have a master's in public health, and I've worked at Allied Health for 10 years, and I work as a pharmacy technician. For
So
most of
even
it.
though you're a novice in working with Fayette Factor and doing this prevention work, you are a public health expert, and in academia, you work with students all the time. So you can speak from your own personal experience about the effects that you have seen you know, I mean, in increases in substance use and tobacco use and opioid use. And you don't have to be the expert. If that's where we're going to give you some information to leave behind. If a legislator were to ask you a question that you did not know the answer to, it is perfectly appropriate. They don't expect you to be the answer person for everything. If they ask you a question that you can't answer, you would say, you know, I really don't know the answer to that question right now, but let me get that answer for you and I will get back to you. The most important thing isn't don't wing it and make up an answer, because our credibility with our legislators is in giving them facts that they can then take there to committee meetings and everything else. So we want to make sure we're giving them accurate facts and they don't get embarrassed by taking something to to a hearing and finding out it wasn't true. So if you don't know the answer, just say, I don't know. And then you can get back to the facilitators and we will get an answer for you to deliver to your representative. Does anybody not know who their representative is? Beautiful. Now I will tell you, I was on another call for a nursing organization, and we had a guest speaker that was one of the Georgia representatives. And let me tell you, people, they are hungry. This is a golden opportunity. They are hungry for constituent contact, because normally at this time of the General Assembly, there are hundreds of people at the Capitol every day. Every day is Teachers' Day at the legislature, Nurses' Day at the legislature. You know, we have our Advocacy Day at the legislature. They're used to meeting with people, talking with people. The lobbyists are there all the time. And now the Capitol is empty, except only for the essential personnel to do business. And they are missing the context. So they will be eager to set up a virtual appointment with you and have plenty of time in which to do so. Okay, I'm going to stop sharing my screen. And anything, and pardon me, anything else I can answer for you? Questions, concerns? Nobody's talkative today. Let me ask you one question. Okay, Yolanda, I think, do you have something?
No, I was just gonna say that I think we did another topic discussion and they went through how to find out who your senator was, as well as I think that question came up again about what if you don't know something. So I'm not sure if the same people have, it's just a different topic, but the same way of how to push and get us to just be ready. So I think that part we've gotten the back.
Yep,
If we've been, you know, coming to the discussions.
Right. Okay. So about identifying your legislators and setting your appointment. Any other questions about the whole tobacco and vaping thing? What I will tell you is one of the biggest. There's two things, just for your own background. There's two things going on right now. A lot of people think that the FDA took flavors off the market. And I just want to reiterate, the only flavors that they took off the market were for the pod-based devices like Juuls with the pod refills. And they limited those to just menthol and tobacco flavor. But all the other products, the e-liquids in the vape shops, and you know those big tanks and mod devices that you see people blowing the huge clouds of vapor, those are still available in flavors. And there are disposable e-cigarettes that are available in lots of flavors. I can show you a couple of other things. And one of the important thing for the legislators to know that if we are going to prevent the next generation of kids from being addicted to tobacco, we've got 90% of current smokers or current tobacco users in any form started before the age of 18. That's 90%. And one of the reasons for that is because young people get addicted to nicotine and other drugs much more easily because of the changes in their brains. And these devices are made to be very discreet and to hide in plain sight and to be able to be used under the noses of everybody. And let me just show you. Do you see a slide that says hidden in plain sight? Can you see that? Okay. There are 6 vaping related devices or accessories in there. So I will show you, in the interest of time, the answers to that question. Let me move on down. There are I'm going to start like from 6 o'clock and go count-wise. That black stig is another vaping device that looks a lot like a vape pen. The one in front of the arrow from the tape dispenser is pointing to an actual Juul. That's a Swarin. That's one that looks like a highlighter or a lipstick. There's 2 vape pens, and there's a Juul pod in there. These are vape accessories. They look like lipsticks. There are smartphones that actually have a vaping device in them. Backpacks, hooded sweatshirts where the tubes are actually vaping devices. You can put your vape in your pocket. And these are like the advertisements that people see. And they have just taken the old cigarette ads and updated them. So that combination of advertising, 4 out of 5 kids have seen ads for e-cigarettes. And let me show you this, that we now have vapes that come in colors, that the smoke comes in colors. So there's an entire culture around youth and vaping. And so it's really important it's a little different than your normal. I wouldn't say your normal because all substance use is abnormal, but it's a little different in that there isn't a huge youth culture that's evolved to this degree around some of our other substances. And like even the skins that you can get to put on to personalize your vape pen, and still tons of flavors. Does that give you a little more background? And the key things there are, tobacco is, this is from a presentation I was doing. there's over 480,000 deaths every year from cigarette smoking, and all the other things it causes: diabetes, cancer, heart disease, other lung diseases. And again, 90% of kids start before they're 18. So if we're going to stop that tobacco epidemic in the United States, we really got to focus on stopping initiation in youth. And in order to do that, we have to be able to stop access. So does anybody know that we raised the legal age to buy tobacco products in the state to 21? That was done nationally in December. But the state of Georgia of December of 1920. No, I'm sorry, December of 1919. This is 1921. So it's been in effect, but the state needs to update its laws, and they did some of that last session, but to be able to enforce it. So right now, our high school kids should not be able to buy tobacco products in their communities. But decreasing access and increasing the ability of parents to know how to talk to their kids, and all those things are really important. Okay, I've just kind of shotgunned a lot of information out there. So help me out. Give me some reaction or comments or other questions if I have sparked some.
I will say that I was one of the people that didn't realize that the flavors were only for the pods, that you could still get the juices and all the colors and flavors. So that's something definitely that I learned today. That's new. So as far as like going to, your legislators or trying to get the virtual meeting, that would be one of the topics that you would want to, discuss and advocate for, right? Is to make sure to try to get, because it's going to be a slow motion of trying to get it removed completely. But as far as like trying to see if they can at least take the flavors out of the disposable ones.
Yeah.
Right. Like, what are some other topics I think that are on the floor right now? I mean, as far as vaping and nicotine use.
There really aren't any. Yeah, one of the policy interventions that is always talked about and is very tough in Georgia is raising our state tobacco tax. Our tobacco tax is, depending on who you look at, 49th or 50th lowest in the country. Now, last year and up until last year, vaping products were exempt from that. They weren't taxed at all. The tobacco tax was only for the combustible products. So last year, a bill was passed in the legislature that did bring the vaping products into the tax structure, but I think at a lower rate. And of course, we live in Georgia, which is a very tax averse environment, but we're also very limited in revenue right now. COVID and everything else has really decreased the state revenue. And one of the ways that you could have a public health win, as well as create some badly needed revenue for the state, is to bring the tobacco tax at least up to the average of what's in the country. And those numbers will be on your information sheet. So let me go over just for a few moments. Let me see if I can share my screen again and bring up that. Here's going to bring up the tip sheet for the legislatures again. So it gives them some education about the, and are you seeing that tobacco? I always check and make sure what I think I'm showing is what I'm really showing. It makes the points that nicotine is highly addictive, that adolescents are particularly susceptible, that nicotine exposure can harm brain development. And these are long-term harms and permanent harms because this is happening when the brain is developing. Nicotine is also toxic. It can be absorbed through the skin and through the eyes and the mucous membranes. So poison control gets thousands of calls every year from toxic nicotine exposure, even like children drinking some of the e-liquids that look like they're in funny fruity flavors. This is some of our grade level information in Georgia that the public health has done about the incidence of vaping. You know, when you talk about 32% of 12th graders, that's almost a third of your kids. That's a lot of kids being exposed to high doses of nicotine and at risk for developing nicotine addiction. Georgia does not have a comprehensive smoke-free law to protect people from secondhand smoke in all areas, indoor areas of workplaces, restaurants, and bars. We do have a smoke-free law, but it's not all-inclusive. So it has been up to local jurisdictions to be able to pass those. More in point, last year, Atlanta went totally smoke-free. The airport went smoke-free. The restaurants went smoke-free. A lot of the local coalitions that have been working on smoke-free policies is it from a workers' health standpoint that everybody deserves to be able to work in a safe workplace. And for the restaurant workers and the musicians that have to work in smoking environments and be exposed to secondhand smoke and vapor, that's a health risk for them that they don't really have a choice about because that's their workplace. So we still have a number of public school districts in the state that have not adopted tobacco-free campus policies. Our University of Georgia campuses are tobacco-free. And here's something, we get a lot of pass-through money from the huge tobacco settlement monies. The tobacco companies lost a big lawsuit, and they're years ago, and all the states get a huge chunk of tobacco settlement money, but that money doesn't always have to be used dollar for dollar on tobacco prevention and control. So in our budget year, it's often diverted. We, for just what we allocate for prevention and quitting, we rank 49th in the United States. And there's about $750,000 allocated and now the Centers for Disease Control recommends spending targets. They recommend spending targets over 100 million, and we do about $1 million. Now, I do want to tell you, for everything tobacco, not just prevention and cessation, the state spent $1.2 billion, which included funds for the CDC, the quit line, and a Medicaid match, because for Medicaid folks, there is some benefits for them if they are prescribed cessation medications. So tobacco use in Georgia costs about 11,000 lives a year, and about $3.2 billion a year in direct and indirect costs, both for the direct costs of the diseases and death tobacco causes, plus the lost time from work and lost productivity. And again, Georgia's ranked 50th in the state for its tobacco tax. So so that's some of the information that you're going to be getting to lead with your legislators.
Excuse me.
Mm-hmm.
I had a question on one of the slides. You had something that was spelled SUNUS on the snuff. It was beside the snuff and yeah. What's that?
Okay. Let me go. I'll show you this. Yeah, it's not just not cigarettes anymore, and that's the thing that the tobacco companies aren't stupid, and they have been. Oh, I'm trying to find this because I know we're basically snooze, and I'm not. Oh, okay. Yeah, I know which one you're talking about. Let me get back to that sheet. I've got 3 different pieces of paper that I've been working with. I can show you, but basically while I'm looking for the picture, snooze is the it's an updated snuff. Snuff is the tobacco in the can, the smokeless tobacco. You take a wad of it, you chew it, or the snuff that you can sniff, but that's really cosmetically yucky. And so what you have right now, and they've got Views is one of the brands. They are now come in cans where they have these little, they look like double-sized chiclet gum, these square pouches with this white, not tobacco looking material anymore. And those come in every flavor in the sun: mint, cinnamon, fruit flavors, everything else. And you just take those pouches and you put them in your mouth, and you just leave them between your mouth and your cheek, or you suck on them, or you chew them. When you're done, you spit them out like a piece of gum. Oh, let me get a picture of snooze for you.
So basically, you don't have the what used to be the cosmetically unappealing person dipping snuff.
Correct. Let me see if I can pull up. Yeah, I can share this with you. I pulled up a picture. These are all the snooze, the different products. This is your old-fashioned snuff, and then your wads of chewing tobacco. But these are your snooze products. And see, they have camel. See, and let's see if I can enlarge that one. Do you see it off to the side?
Mm-hmm.
And enlarged? Yeah. And general snooze, there, I'm putting that one up there. General snooze actually applied to the FDA and got a limited, not an approval for the FDA as being approved, but that they got a reduced risk designation they can put in their advertising, because they could show that it was a reduced risk over combustible cigarette smoking. But you know that all your chewing tobaccos can cause mouth and lung and laryngeal cancer and all those oral cancers.
So this snooze has probably just as much nicotine.
Oh yeah, I mean they're yeah.
Mm-hmm.
You can see some more pictures. Velo is one of the brands that I was actually coming back from doing a training presentation to a provider group in Forsyth County, and there was one of these big digital ads on 85 South for Velo, and I was like, oh my gosh, because you can't advertise cigarettes anymore. That was the 2009 Tobacco Smoking Act, but there's no laws that prevent you from advertising these alternate tobacco products.
Oh. Hmm.
So you can see ads on, on buses, on wrapped around cars, and on billboards.
Okay, thank you.
Anybody else? Gabrielle, you know how much time we're going to be in here?
Actually, it looks like our time is about up. It was supposed to be around 2:45.
Okay, good. I knew you were doing. So this is last call for questions. And let me ask you, has this been helpful for you? Good. Excellent. And I'm going to put my email address in the chat box. And if anybody has any further questions come up, or you get asked a question by a legislator about tobacco that you need an answer for, feel free to get in touch with me. There it goes. And Gabrielle, I'm sorry, your name says Gabrielle. I know you prefer Gabby, and I apologize.
That's no problem at all. But yeah, it did go on the chat.
Yeah, and are they going to close out the breakout room, or should we leave and go back on our own?
That's what I'm wondering. I think we could all go back.
Okay, so thank you all. It was wonderful to meet all of you. And if you'll just say leave room, and that'll put us back in the main room for whatever final comments our organizers have for us. But thank you so much for your attention and your questions. I've enjoyed getting to work with you a little bit.